The most common side effect of insulin is low blood sugar or hypoglycemia. Low blood sugar happens when the level of sugar in the blood falls below 70 milligrams per deciliter. Symptoms include sleepiness, shaking, sweating, dizziness, and hunger. Be sure you know how to treat low blood sugar before you start using insulin. You will need include the prescribed insulin pen needles, alcohol wipes, and a container for used equipment. You can use a hard plastic container with a screw-on or tight lid, or a commercial sharps container. Begin by washing your hands. Remove the cap of the insulin pen. If the insulin in the pen appears cloudy, roll the pen in your hands and turn it from side to side for 1 full minute. You do not have to roll the pen if the insulin is completely clear. Do not shake the pen.
Instructions for injecting insulin with a pen and pen needle. Always start by washing your hands. If you take 2 insulins, check the pen label to make sure it's the insulin you intend to inject. It's a good idea to write the date on the pen of when you first opened it, as it is only good for 28 days. Take the cap off of the pen and wipe the tip with alcohol. Choose 1 pen needle. Tear the paper off and keep the needle in its safety cap. Screw the pen needle onto the pen until it stops turning. Take the white safety cap off and remove the colored needle cover. Perform an air shot by dialing to 2. Hold the pen up and away from you, push the injection button, and look for a drop of insulin on the needle tip. If you don't see a droplet, repeat this step. Your needle may be bent if no insulin comes out, and you should replace it with a new pen needle. Repeat this step until you see the droplet form. Turn the dial to the correct dose of insulin. For this example, we will use 10 units.
Since you will be injecting your insulin on a regular basis, you need to know where on your body to inject it. You will also need to learn how to rotate or switch your injection sites. Recommended injection sites include the abdomen, front and side of the thighs, upper and outer arms, and buttocks. Do not inject near joints, the groin area, the navel, the middle of the abdomen, or scar tissue. If you use the same injection site over and over again, you may get hardened areas under your skin that keep the insulin from working properly. Rotating your injection sites will make your injections easier, safer, and more comfortable. Follow these guidelines. Ask your healthcare provider which sites you should use. The injection site is about 2 inches of skin. Clean this area in a circular motion with an alcohol wipe. Move the site of each injection. Inject at least 1.5 inches away from the last spot where you injected. Try to inject in the same general area of your body at the same time each day. Keep a record of which injection sites you have used. Every time you give yourself an injection, write down the date, time, and site. Please note, depending on which type of insulin you are taking, absorption may be different for different parts of the body. Talk to your healthcare provider to learn more about the insulin you are using and which sites work best.
Skin with an alcohol pad. Dry off any excess alcohol on your skin before injecting. Do not inject through clothing. Pinch a fold of your skin between your thumb and finger. With your other hand, hold the pen at a 90-degree angle to the skin and insert the pen with one quick motion. It helps to hold the pen like you're giving a thumbs up and push the pen injection button with your thumb. Push the injection button at a moderate and steady pace until the insulin is fully injected. Keep the needle in your skin for a count of 10. Then you can pull it out of your body. Remove the needle from the pen by replacing the large white cover and unscrew it. Dispose of your used pen needle in a safe sharps container. Never leave the needle on your pen. Doing so can result in leakage or air bubbles.